One emergency I see far too often is cats with urinary blockages. Left untreated, this quickly becomes life-threatening. I'm Dr. M. Welcome to VMC. Today we're going to cover urinary blockages in cats, the early symptoms you need to look out for, what you can do to try to reduce the risk your cat ever experiences one, and how to act fast if you suspect your cat is ever having one, as it could save their life. So join me today, you'll learn something. When a cat experiences a blockage to their urinary tract, it's most often in the urethra. When this occurs, the cat is unable to empty their urinary bladder, and this results in toxins building up in their body because the kidneys and the urine flush so many things out of the body. As these toxins build up, it can cause the heart to have arrhythmias, they can go into shock, they can get really low in body temperature, and this is why it can quickly be a fatal issue. That's why recognizing any symptoms early is absolutely crucial. Key symptoms that I want you to be watching for with your cats are any changes to the frequency that they're going to their litter box. This is one of the many reasons why scooping boxes twice a day is so very important. It means that the time between when the change occurred and when you notice a change is much shorter, and that can be incredibly key for your cat. Sometimes you will notice that their frequency of urination hasn't changed, but that they've started to strain to urinate. Or they might be urinating very small amounts very often. And sometimes they might start urinating outside of their litter box. Some cats will show signs of discomfort that might include things like crying or meowing, but it often will include changes to their behavior, and this could include excessive grooming at their back end. You might note that there's blood in their urine, but not always. Their appetite might decrease, their drinking habits might change, and as the issue becomes more serious and progresses, you will notice lethargy. This can lead to vomiting and collapsing as well. And if we don't catch that a cat has a urinary blockage fast enough, it will be fatal. It's because of this that even subtle changes in bathroom habits are considered an urgent issue. And even if they aren't fully completely blocked, but they're only able to get small amounts of urine out, this is considered an emergency. Now, this issue is more common in male cats than in female cats. This is because the male cat urethra is longer and it's also narrower in diameter than the female cat's urethra. If you suspect that your cat is having trouble urinating or you think they have a complete blockage, here's what you need to do. Stay calm, but act fast. Call your vet clinic. Tell them that you're coming in and what the issue is. This may mean being redirected to an emergency clinic. Do not try to wait this out or treat it at home. It is an emergency, and the faster you act, the better the outcome will be and the lower your cost will be to treat it. Keep your cat as comfortable and warm during transport as you can. Hopefully you will have already worked on reducing your cat's stress with vet clinic appointments. Quick action can truly make all the difference here. Once you get to the vet clinic, you can expect a few things to happen. Once we've confirmed that there is in fact a urinary blockage, the first thing we're going to want to do is start your cat on IV fluids, get a blood sample running to check for electrolyte imbalances and how the kidney health is, etc. And then we're going to sedate your cat, give them a block for pain management. They may need general anesthesia depending on how painful they are, and we're going to unblock that urethra. There are occasionally going to be situations where we might not be able to unblock them, but in the vast majority of cases we can. There are some techniques and tips and tricks that will try to make it happen. Once they're unblocked, we will continue IV fluids to rehydrate them. We'll give them medications to reduce inflammation, treat any infections. We will also give them medication for pain management. We will need to keep monitoring their kidney function and their electrolytes, and after a couple of days of hospitalized care, the vast majority of these cats do get to go home. Once your cat is being discharged from the vet clinic, you can expect that there will be some changes in order to try to reduce the likelihood that your cat experiences a recurrence of this problem. This will include treatment for any infections or bladder stones or any other medical underlying contributing factors that might be present. Your cat may also need additional pain management while at home, and you should expect that there will be a change in their nutrition. There are some prescription urinary health diets that can reduce the likelihood of them having issues in the future, and I would expect your veterinarian to send your cat home with one of those. It will also be important to ensure that your litter box husbandry is impeccable and that your cat is receiving all the enrichment they need, as both of those things help to reduce their stress, which reduces the likelihood of them having lower urinary tract problems in the future. Now, the prognosis is quite good, and with prompt intervention, 90 to 95% of these cats do really well. Recurrence rates vary depending on which research studies you're looking at. Sometimes the recurrence rates might be as low as 15%, but it can go up to about 40%. In some of those cases, it's because they've developed scar tissue in the urethra that makes their urethral diameter even smaller, which makes them even more likely to block. Now, about half of these cases are secondary to cystitis. I have a previous video on the topic. I'll make sure it's linked in the video description for you. But around 29% are because of bladder stones, and about 18% are because of urethral plugs. Those plugs can be made up of cellular debris and mucus and crystals in the urine and other things. A urinary tract infection is actually quite uncommon. What I will always be asked is what we should be doing in order to prevent these issues from happening in the first place. And as you know, whenever we can prevent something, I am all about it. The first thing is to ensure that your cat always has plenty of easy access to fresh water sources. Your cat should have a water source on every floor of your home, and if you have multiple animals, you will also need multiple water sources. At least one of the water sources for your cat does need to be a fountain, as some cats have quite the preference for running water. All of the water sources need to be in stainless glass or high quality ceramic bowls, no plastics. This is because we want the water to remain fresh and to not be harboring bacteria and little scratches in the bowl over time. Lastly, you need to completely, even for the fountains, dump out the water, wash the bowl, rinse the bowl, and refill the water every single day. This is important. If you're not doing this, your cat will not want to use the water bowl and they won't drink as much. And then when they don't drink as much, they're not flushing out their bladder as often, and this can make a blockage more likely. Especially for multi-cat households, this matters, but for every cat, it's important. Reduce their stress as much as you can. The best way to do this is to have a predictable schedule and to meet all of their enrichment needs. Meeting feline enrichment needs is one of the very first videos I ever did because so few people do the basics in their households, and you need to be. It's part of having a cat. A huge factor is to keep your cat at an ideal body condition score. Cats that are overweight and obese have a much higher risk of a urinary blockage. If your cat is currently overweight or obese, work with your veterinarian on a safe weight loss plan to help them out. Another crucial factor is to feed a research-based diet that is properly formulated and that meets or exceeds every single one of the WSAVA guidelines. The vast majority of the blocked cats that I see are cats that are on diets that do not meet WSAVA guidelines. Those diets are going to be more likely to cause your cat's urine pH to be abnormal, more likely for them to develop crystals and stones in their bladder, more likely for them to have irritation and inflammation in their urinary tract, and therefore more likely to have a blockage. Note that I've said doing all of these things reduces the chances that your cat will have an emergency like this. It does not make those chances zero because genetics do also seem to matter, and some cats will just have a more narrow urethra by chance, by just normal variance than others do. All we can do is stack the odds in your cat's favor as best as we can and control the things we can. The rest of it isn't under our control, so there is always going to be some risk for a blockage, which is why knowing the symptoms to monitor for and what to do if you see them is so very important. If you have a question, make sure you leave it in the comments. I always love to hear from you, and if you have a topic you want me to cover in the future, don't hesitate to ask. That's how I get the list of videos that I'm doing. It's because they're all suggested by you. So please let me know what you want me to talk about and what you want me to cover in a future video. Thanks for watching VMC. I'm Dr. M, and don't forget to subscribe so that you can keep learning these life-saving tips to care for your pets as best as possible. I'll see you in the next video. Bye-bye.